reducing health inequalities is everyone's business, and it's not only the NHS. I think broadly, in terms of the role of technology in addressing health inequalities, there are a number of dimensions that I think is important to call out. There's something about co-design that technology companies intentionally and proactively reach out and engage underserved, seldom heard communities at the design stage of their products. Mm-hmm. So Devices for Dignity, which is a medtech outfit at Sheffield Teaching Hospitals, are doing some fantastic work in this space in terms of that co-design with their local communities. The other dimension, I think, is in terms of using their role as anchor institutions. So a lot of technological companies will be situated in communities. And by employing people from the local community, by procuring as far as is possible from the local community, by making their estates useful to the community where they operate, can be a really powerful way of technology companies fulfilling their roles as anchor institutions, and by so doing, addressing the wider determinants that drive health inequalities. There's also something about the decision about where they site their business. I think of the commercial aspirations of a local community, particularly in terms of diagnostics. So I was at B. Brom, which is a devices manufacturing company with its headquarters in Sheffield recently. And you can see how their presence in that community is vital to the community in terms of its commercial viability. So I think, there is that dimension of it in terms of being an anchor institution. The other dimension is to mitigate against digital exclusion, that we adopt an inclusive by design ethos, understanding that there are large swathes of the community that may have poverty of devices, or poverty of data or connectivity, or poverty of the built environment. And so I think if we adopt an inclusive by design ethos as a meaningful way of ensuring digital inclusion, that is another way that I believe technological companies can leverage, their position to be allies in our work to address health inequalities.
Do you think that there is an opportunity there really to better design those solutions for users? I suppose you've spoken around that, really involving users in the process, but do you think that's being done enough at the moment?
I think we have a huge way to go with that. My position is that technology is an enabler and an accelerator for narrowing the gap on health inequalities, handled well. And I think the handled well needs to be about, technology, the technology industry being mindful of the risks, and also being part of the solution. So as I mentioned earlier about actually involving the end users at the design phase, the deployment phase, the rollout phase, as well as in the evaluation phase. So across the whole product life cycle, the involvement of the end user, particularly the seldom heard marginalized user, because there's a tendency to reach out to the articulate user with agency. And if we do that, we're just going to exacerbate health inequalities. The technology industry needs to think about how it squares the circle of innovation affordability, and equitable access. Those three dimensions are fundamental. If innovation broadly and technology are going to be part of the solution to reducing health inequalities rather than exacerbating pre-existing health inequalities, is the other thing that I would say. I also then think, in addition to co-design, in addition to involving people through the product pipeline, in addition to the health and digital literacy element, I also think there is something about diversity of the innovator ecosystem and making that ecosystem more accessible to communities that hitherto have been underrepresented in that space. That's another dimension where I think the technology industry probably can do more. And as the Harvard Business Review have shown us, that actually diversity at board level is not a tokenistic, moral, ethical imperative. Actually, the most sophisticated, most productive, most profitable companies understand that diversity of thought and diversity of representation is a business imperative. And I think that the technology industry will do well to address that dimension of inequity as well. I think the question of data is really important. So the data that underpins our conceptualization of which products to develop. And in particular, if we think about AI and we think about the genomics space, up to 96% of the reference data upon which our AI algorithms are being trained, upon which a lot of our genomics interventions are being designed, the reference data is up to 96% European ancestry. I think that is a challenge that the industry needs to be very clear-eyed about and understand the inherent bias, therefore, in many of the technological products that we are designing, constructing, and deploying on the basis of that reference data. And I think in a post-pandemic world, where we saw in the most brutal terms what happens in a public health emergency if you have inequity baked into your infrastructure, it then becomes a public health emergency of not just those marginalized communities, it becomes a public health emergency for us all. And I do think that one of the biggest learning, and therefore one of the biggest legacies beyond the pandemic, is for us to embrace the opportunities of AI and genomics with an understanding that we have an enormous amount of work to do to diversify the reference data. And if you have a look at the OECD's digital map, you will see that there are large swathes of the world that are digital deserts, which means that their populations are not represented in the data. And a big macro, maybe even meta question for the industry is, what is the answer to that? Otherwise, we are in danger of sleepwalking into the next public health emergency because we haven't been clear-eyed about this particular challenge.
there's lots of technology companies out there that might have solutions that could help, and perhaps they're thinking, how can they get noticed? How can they gain traction for what they're doing? What would be your advice to them if perhaps they've gone through the process where they've done their research and if they had taken on board the user-centered design approach, and they have something that's valuable, but selling into the NHS can be very difficult. How can they go about getting the attention of the right people to get their solutions noticed?
I think fundamentally the NHS is in the business of people, and the most successful organizations, the most successful technology outfits are the ones who are authentic about solving people issues. And the job then becomes a lot easier. So the NHS constitution is clear that we must run our services in a way that deliberately ensures that we reach communities who otherwise will be left behind. That's in our constitution. The NHS long-term plan also talked about accelerating activity to reduce health inequalities. We also know that in the government's Levelling Up white paper, there is a very clear commitment to reducing the healthy life expectancy gap between the richest and the poorest, and to increase overall healthy life expectancy by 5 years by 2035. And so it's about how the industry aligns its products to those stated government and NHS priorities, of which I am calling out health inequalities as a specific one.
Yeah.
And we've already outlined that it's the domains of access, of experience, and of outcomes. We've also clarified the population group of focus, the Core 20 Plus. We've outlined the clinical areas of most concern in Core 20 Plus 5 for adults and Core 20 Plus 5 for children and young people. We've outlined our 5 strategic priorities to inclusively restore our NHS services in elective care, urgent and emergency care, GP access. The second priority is to mitigate against digital exclusion. The third is to ensure that data sets are complete and timely, especially ethnicity coding. The fourth is to accelerate on preventative interventions like Core 20 Plus 5. And the fifth one is to strengthen leadership and accountability. So if I am the CEO or I sit on the board of a technology company, I would be looking at my product pipeline and the extent to which there are solutions to those strategic priorities. Because if there are solutions to those strategic priorities, then the landing of the message is a lot more straightforward. And because it resonates, it aligns, and it provides answers to the strategic questions of the organization, it becomes a much more collaborative, collegiate, mutually supportive conversation rather than a selling conversation, as it were. Reducing health inequalities is everyone's business, and it's not only the NHS. I think there is a real opportunity for the technology and digital industry to actually come together, maybe under the auspices of the Association of British Health Tech Industries, the ABHI, who I know are completely supportive and committed to the health inequalities improvement agenda. Is there an opportunity under the umbrella of the ABHI to create an industry code of conduct around digital inclusion, and building on that code of conduct to then have an industry charter on digital inclusion, and then building on that to have an industry digital inclusion framework? Because then you have a statement of strategic intent and you have a clear vehicle for implementation. That's what I think is the space at the moment.
Excellent. I think there's some very clear call to actions there for the NHS, for the digital health community, for the health tech community more widely to consider. And I think clearly with that there's a lot of opportunity to better address healthcare inequality. So that's been really useful. Thank you very much for that.
Pleasure.